Hello friends, welcome to my channel Clinical Biochemistry by Dr. P.K. Prabhakar. Today I am going to talk about one of the important autoimmune disorders, that is systemic lupus erythematosus. Commonly this is also called as lupus. So lupus, technically known as SLE or systemic lupus erythematosus. If you see the basic introduction of this disease is, lupus is an autoimmune disorder that occurs when your own body, own immune system attacks your own tissue, or your immune system starts producing antibodies against your own tissue, cells and different organs. So that is called as autoimmune disorders, and this lupus is an autoimmune disease. In this case, inflammation is going to be caused by lupus, and that is going to affect many of our body systems like our joints, skin, kidney, blood cells, brain, heart, lungs and number of other tissues also. And if we'll say this, one of the lupus is systemic lupus erythematosus. There are different types of lupuses we are having. One of the lupus is SLE, systemic lupus erythematosus, and that is most common lupus. This SLE is an autoimmune disorder in which our own immune system attacks our own tissue and going to cause inflammations in the tissue, and ultimately it will cause the tissue damage in the affected organs, where this SLE can affect joints, skin, brain, lungs, kidney and many of the blood vessels. There are no cure for this lupus, but medical interventions and the lifestyle changes can help us to manage it, can control it, but overall we don't have any significant treatment or significant means any complete permanent treatment we don't have. If we'll say how this serious this SLE is, the seriousness of this systemic lupus erythematosus can range from mild to the life threatening, and the disease should be treated by the doctors or the team of doctors who specialize to care the SLE patients. And the people who have this lupus or SLE that gets proper medical care, preventive cares and education can significantly improve function and quality of the lifespan. Now if we'll say what is the basic cause of this SLE and what is the means ultimate etiological features of this SLE. The cause of SLE are unknown, or it is not very clear. It is thought of involves different factors, like there are linked that it can be caused by environmental, genetic, hormonal factors, or number of other factors also. Like here if we'll say this is going to cause by genetic, as you see can here, genetic, environmental, immunoregulatory factors, hormonal or epigenetic, different factors are there. So SLE is presumably caused by the genetic susceptibility coupled with the environmental and many other factors. If you talk about ultimately when because of these factors the immune systems get activated, immune system is going to damage the cells, and ultimately the nucleus is going to be cell will go for fragmentation, apoptosis will be caused, and ultimately nuclear fragment is going to activate our cells for the production of nuclear proteins are going to activate our immune system for the production of antibodies. So that is auto antibodies. Now one by one if you see genetics, SLE does not runs in the family, but no single causal genes has been identified. Instead, multiple gene appears to influence the person's chance of developing lupus when triggered by environmental factors. It is also going to be caused by some of the drug reactions, that is we are going to call it drug induced lupus erythematosus, and that is a reversible condition that usually occurs in the people who treated with the long term illness. Drug induced lupus mimics SLE, that is not exactly SLE, but it is going to mimic the SLE. If you see the pathophysiology of this SLE, in SLE the body's immune system produces antibodies against our own protein, that is self protein, particularly against the protein of the cell nucleus. So that's why I have called it is nuclear proteins. These antibody ultimately attacks the immediate cause of SLE. So SLE triggered by different factors, as we have seen, either it will be genetic factor or environmental factor or different other factors. The SLE, the body's immune system produces antibodies against the own protein and attacks. SLE is a chronic inflammatory disease believed to be type 3 hypersensitivity reactions. Type 3 hypersensitivity reaction is the reactions. We have 4 different type of hypersensitivity. type 1, type 2, type 3 and type 4. Type 3 are those means hypersensitivity where antigen antibody complex formation takes place, but our immune system are not able to remove it, not able to so because of those antigen antibody complex formations, we are ultimately going to have inflammation. So that SLE is a chronic inflammatory disease where type 3 hypersensitivity reaction response is going to works or involved. Reticulate and stellate acral pigmentation should be considered a possible manifestation in case of SLE, and high titer of anti-cardiolipin antibodies or consequence therapy. What is the pathophysiology is? Those patients or those people who are having SLE have intense polyclonal B cells and activations, with the population shift towards the immature B cells, and the memory B cells with increased, especially CD27 plus IgD, are less susceptible for immunosuppressions, and the T cells which regulates these B cells responses and infiltrate target tissue have defect in signaling, adhesions, co-stimulation and gene transcription, and ultimately alternative splicing. The cytokines, there are a number of cytokines which is produced from this T cells and B cells are going to be involved in this SLE pathophysiology, and those cytokines are B lymphocyte stimulators, interleukin 6, 17, 18, type 1 interferon, tumor necrosis factor alpha are involved in this inflammatory process and potential therapeutic. It can be potential therapeutic target also. Now, if we'll say the cell death signaling, because I have told you in this case ultimately going to have the cell death or apoptosis is going to happen. So apoptosis is increased in case of monocytes and keratinocytes on our skins. Expression of FAS is a protein by B cells and T cells is also increased. There are correlation between the apoptotic rates of lymphocytes and the decreased activity, and necrosis is increased in case of T lymphocytes. So this is especially related to the cell signaling, cell death signaling, or you can call it apoptotic signaling, because antigen antibody complex formation takes place, and that is also going to works for complement system activation. So in the complement systems, low C3 levels are also associated with SLE. Tangible body macrophage. This is a specific type of macrophage which is a large phagocytic cells in the germline center of secondary lymph nodes. This macrophage going to express CD18 proteins, and these cells are normally going to engulf the B cells that have undergone apoptosis after the somatic hypermutations. But in the case of patients with the SLE, the significant less number of this specific macrophage can be found, and these cells rarely contains the material from apoptotic B cells, and also uningested apoptotic nuclei can found outside the TBM, this macrophage. Necrosis, which is a pro-inflammatory forms of the cell death, is also increased in the T cells, as we have seen here, due to the mitochondrial dysfunctions, oxidative stress, and the depletion of the energy source, that is ATP. Now, if you see the sign and symptom of this SLE, there are different sign of symptom according to the specific tissue, specific organs we are having. Otherwise, we are having discoidal rash, serositis, oral ulcers, arthritis. Then we are having photosensitive rashes, blood dyskaryosis, renal disorders, nuclear antibody formations. Many different type of sign and symptoms will be there. So SLE is one of the several diseases have the great imitator, because it can often mimics or mistaken with the other illnesses, because many different sign and symptoms you can have. SLE is a classical items of the differential diagnosis, because SLE symptoms are very widely and comes and go unpredictably. Diagnosis can thus be elusive, with some people having unexplained symptom of SLE. So different organs will have different kind of sign and symptoms. If you go for skins, as many as 70% of the people with SLE have some skin symptoms. The three main category lesions are chronic cutaneous discoidal lupus, subcutaneous cutaneous lupus, and acute cutaneous lupus. So these are the three different category of lesions which can occur on the skins, which is chronic cutaneous, that is discoidal lupus, subcutaneous subacute cutaneous lupus, and acute cutaneous lupus. Then muscles also we have a specific type of sign and symptom, and means a different organ will have different type of sign and symptoms, especially in case of SLE. Now if we'll go for it's a diagnosis, how we can diagnose this SLE. So there are different kind of tests we are having. One of the significant tests we are having for the diagnosis is that is on the basis of anti-nuclear antibody. This is the most significant test we are having, that is anti-nuclear antibody testing and anti-extractable nuclear antigen, anti-ENA you can call it. Forms are the mainstay of serological testing for SLE. If ANA, that is anti-nuclear antibody, is negative, this disease can be ruled out. So that is the common for all the type of SLE. Several other techniques are also going to be used, like we are going to use CBC test with the differential counts. X-ray can be done, serum creatinine can be done, and urine analysis can also be done. The most widely used is indirect immunofluorescence test. The pattern of fluorescence suggests the type of antibody present in the body's serum. Direct immunofluorescence can detect deposits of the immunoglobulins and complement proteins in the people's skin. So that is the diagnosis you can do it. There are different criteria has been given by diagnostic criteria. So the American College of Rheumatology establishes 11 criteria in 1982, which were revised in 1997 as a classificatory instrumentation for the operation of the SLE. And there are, if for the purpose of identifying people for clinical studies, a person have SLE if any 4 out of 11 symptoms are present simultaneously or serially on 2 separate occasions, we can call them they are having SLE. What are those 11 symptoms? Like malar rash on cheeks. It is having sensitivity 57%, specificity 96%. Then discoidal rash, red scary patches on the skin that causes scarring, sensitivity 18%, specificity 99%. Serositis, pleurosis, that is inflammation on the membrane around the lungs, and pericarditis, that is inflammation of the muscles membrane around the heart. It is having sensitivity 56%, specificity 86%. Then we are having oral ulcers, arthritis, photosensitivity, blood, different types of, we are having, in case of blood, we are having different hemolytic anemia, leukopenia, low platelet count, lymphopenia, number of other things. Then we are having renal disorders, where we are going to call different type of test for the urine analysis. Anti-nuclear antibody testing positive, it is having maximum sensitivity, that is 99% sensitivity. And then we are having different type of immunological disorders. So these are neurological disorders. These are 11 different types of criteria have been given by American College of Rheumatology for the diagnosis of any person who is having SLE. Now if we will come to the treatments, so I have told you there are the treatment for the SLE involve preventing flares and the reducing their severity and the duration when they occurs. Treatment, there is no cure for the SLE, exact treatment we don't have. The goal of the treatment is to control the sign and symptoms. Severe symptoms that involves the heart, lungs, kidney and other organs often needs treatment by specialists. Each person with SLE needs evaluation regarding how active the disease is, what part of the body is affected, and what forms of treatment is needed by that particular patient. The mild form of disease may be treated with either non-steroidal anti-inflammatory drugs for joint symptoms and pleurisitis, low dose of corticosteroids such as prednisone for skin and arthritic symptoms, corticosteroid creams for skin, hydroxychloroquine that is a medicine for malaria, that is also we are going to use. Methotrexate may be used for the reduce the dosage of corticosteroids, and belimumab, that is an biological medicines because it is monoclonal antibody that is help for some of the patients. So these are some of the medicines. So this is all about the pathophysiology, sign and symptoms, treatment, strategy, criteria, diagnostics for the SLE. Hope you have understand it. If you have any query, any comments, you can write in the comment box. If you have not subscribed my channel, you can subscribe it. Thank you very much. Have a nice day.